For women entering menopause, a common but little discussed problem that can dramatically affect quality of life is increasing pain during intercourse. While there are several treatment options available, many clinicians aren't up to date. We're going to discuss this issue now. You're listening to ReachMD, coming to you from the Omni Education's Women Health Annual Visit in Atlanta, Georgia. I'm Dr. Tom Wright, and with me today is Dr. David Gandell, Clinical Professor of Obstetrics and Gynecology at Strong Memorial Hospital of the University of Rochester. Today we're discussing treatment options for painful intercourse in menopausal women. Dr. Gandell, welcome to the program.
Thank you, Dr. Wright. It's a pleasure to be here.
What are the physical changes underlying painful intercourse in the postmenopausal woman?
All right. Well, to understand the changes that occur after menopause, we have to look at what makes up the healthy premenopausal vagina. The healthy premenopausal vagina has a relatively thick mucosa. It has a fair number of what are called superficial cells that help protect the wall. These superficial cells shed into the vaginal cavity, and they are very high in something called glycogen. And glycogen then acts as a substrate for lactobacillus to break the glycogen down and produce lactic acid. Lactic acid then lowers the pH of the vagina and keeps pathogens that are normally present, various organisms from the colon or from the skin, strep, staph, E. coli, Klebsiella, and others, under check, and makes the dominant organism, lactobacillus, supported. There's also an increase in blood flow that's brought about by estrogen. So that helps keep the vaginal wall supple, more pink, there's more moisture, and it also helps any minor abrasions to heal. After menopause, there's a dramatic decrease in the level of estrogen. And as a result, there's less blood flow to the vaginal wall, and the vaginal wall cells begin to thin, and the number of superficial cells, which generally produce glycogen, diminish from being perhaps 15% of the wall to maybe 1 or 2%. Without the presence of glycogen, there's no support for lactobacillus, and the vaginal flora, the microbiome, becomes replaced with the other organisms that are often quite irritating. And those irritating organisms can help then cause the pain during intercourse. They can inflame the vaginal wall, the wall is thinner, it can become abraded more easily. Some women describe it as feeling almost like pins and needles or tiny cuts. And then, of course, what happens is they stop having intercourse as frequently, and then because of the thinning, the vagina also begins to contract a little bit, gets tighter, the pain gets worse, they avoid sex more, and it becomes kind of a vicious circle.
Right. Are clinicians aware of this issue, and do they know how to treat these issues?
Well, I think many physicians are aware of it, but how much they stay on top of it and how much they offer treatment, I think has a lot to do with their comfort at discussing sexual concerns with patients. I mean, sometimes a patient might have been asked, are you having intercourse? Or might have checked that on as a yes or no on their form that they filled out for their annual exam, but they might not indicate the why and the where. So a woman might have stopped having intercourse, and the physician might feel, well, we don't have to talk about that. Well, in fact, the reason she stopped is because it hurts, and it should be discussed more.
Right. So really, communication between the clinician and the patient is one of the major barriers to addressing this issue in their patients.
It really is. The physician has to be comfortable with it. Patients often won't bring it up spontaneously because they're embarrassed. Many patients think that it's only happening to them, that they're the only one that has problems with painful intercourse. Well, in fact, it's an incredibly common problem. Probably 40% of all postmenopausal women experience significant discomfort with sex if they don't have treatment.
If you're just joining us, you're listening to ReachMD. I'm Dr. Tom Wright, and I'm speaking with Dr. David Gandell from the University of Rochester. We're talking about treatment options for painful intercourse in menopausal women. What are the treatment options, Dr. Gandell?
Probably the most common treatment that's tried is vaginal lubricants, or our vaginal lubricants. Many patients have tried it before they've even come to their physician. Some people try things like various jellies and ointments. Sometimes they'll try over-the-counter things like baby oil or Vaseline, neither of which work particularly well for most patients. There are some really excellent lubricants around. Although they can help, they really don't solve the underlying problem. So the real way is to try to restore the vagina back to its premenopausal state. The most common treatments are estrogen. A woman might be on systemic estrogen for hot flashes. That will secondarily often help the vagina. But estrogens can be used in the vagina, either in the form of creams of various kinds. There can be vaginal tablets that can be placed in the vagina that are specifically for that indication. There is a vaginal ring that can be worn for 3 months at a time that releases estrogen into the vagina. And there's now a new oral option that's in the category of selective estrogen receptor modulators called SERMs, and this one specifically targets the vaginal wall while not turning on other estrogen receptors. Unfortunately, none of those options are available to someone who can't use estrogen or won't use estrogen. So, for example, women who've had breast cancer who are either now menopausal or because of their chemotherapy or other treatments have become physiologically menopausal, many of them are unable to have intercourse and are not able to use vaginal estrogen. Recently, a new device has become available called the Mona Lisa Touch laser. It uses fractionated CO2 laser to stimulate the vaginal mucosa to regenerate itself, to thicken, to basically have effects that estrogen would have had without any particular systemic estrogen effects and no particular risks. And it's very effective. The wall begins to thicken. As it does, the cells migrate to the surface, create glycogen, put it in the vagina. The lactobacillus regenerates itself, the pH falls, the abnormal bacteria are suppressed, and the process that occurred with menopause can be reversed. So the options are hormonal or non-hormonal.
Very interesting. With that, I want to thank my guest, Dr. David Gandell. We've been talking about treatments for painful intercourse in menopausal women. I'm Dr. Tom Wright, and you've been listening to ReachMD at the Atlanta Women's Health Annual Visit Meeting. Be sure to visit our website at reachmd.com, featuring podcasts of this and other series, and thank you for listening.